As a podiatrist, I see a range of conditions come through my office every day. Some are so common that I explain things the same way every time. It's common to treat these conditions, but I didn't expect to get one myself. My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Imagine my surprise when I stepped out of bed one morning and it felt like an ice pick entered my heel. I knew right away that I learned what plantar fasciitis felt like firsthand. In today's video, we'll discuss plantar fasciitis and how I treated myself to overcome the condition quickly. But before I get into it, I wrote a book all about heel pain and plantar fasciitis, and I'd like to send you a copy as a gift. Visit www.heelpainbook.com to order your copy. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. Imagine that the bottom of your foot has a thick, strong band running from your heel to your toes, kind of like a rubber band. This band is called the plantar fascia, and it helps hold up the arch of your foot and absorb shock when you walk, run, or jump. Plantar fasciitis happens when this band gets irritated or swollen. It's kind of like when you overstretch a rubber band too much and it starts to get little tears in it. This can happen for a few reasons. The first reason is overuse. If you're really active, like if you run a lot or play lots of sports, you may put too much stress on your plantar fascia. Foot structure also plays a role. Sometimes if your feet roll inward too much when you walk, called overpronation, or you have very high arches or very flat feet, it can also cause stress on your plantar fascia. Wearing shoes that don't support your feet well or are worn out can also lead to plantar fasciitis. Being overweight can put extra stress on your plantar fascia too. This causes it to become overloaded and inflamed. The most common symptoms of plantar fasciitis include pain in the heel, which is the most typical symptom. The pain often feels like a stabbing pain in the bottom of your foot near the heel. It's usually worse right when you first get out of bed in the morning or after sitting for a long period of time, and it might get better as you walk around a bit. Your foot might feel stiff and achy, especially in the morning or after resting. Sometimes the bottom of your foot might look a bit swollen or feel tender to the touch. It's like your foot is telling you that it's been overworked and needs some care. My heel was definitely calling out for care. I figured that I'd start like I would for anyone else who come into my office with the same condition. I'd start by controlling inflammation and mechanics. When it comes to managing inflammation, there are a couple of choices. My go-to choice is a corticosteroid injection to the heel. The problem is, I wasn't going to be able to inject my own heel. Some people can, not me. So I opted for oral anti-inflammatory medication myself. To control mechanics, there's not much else I have to do other than wear the custom orthotics that I already wear daily. Custom orthotics are special shoe inserts that are made for your feet. They help your feet feel more comfortable and improve how you walk. When you come to a podiatrist like me and we think orthotics might help, we start by looking at how you walk and checking your foot shape. We might use special machines to see exactly how your foot moves. Then we take a mold or digital scan of your foot. The mold is like a perfect 3D copy of your foot, and we use it to make the orthotic fit just right. Orthotics help support your arches and reduce the stress on your feet, which can be very helpful if your feet hurt from being flat or have high arches. Orthotics help keep your feet, ankles, and even your legs in a better position. This is great if your feet overpronate or roll out too much when you walk. Orthotics can make walking, running, and even standing more comfortable, especially if you're on your feet a lot. They also help manage and prevent pain, not just in your feet, but also in your knees, hips, and back. Sometimes, problems in your feet can affect the other parts of your body. People use orthotics for many reasons, like to help with sports, everyday comfort, or to help with specific foot problems, like plantar fasciitis. Back to me. I also use Shockwave Therapy to treat my heel pain. Shockwave Therapy is a cool kind of treatment that we use for some foot problems like plantar fasciitis. And not as scary as it sounds. It doesn't use electrical shocks, but rather sound waves. We use a special machine that sends sound waves, these are the shocks, deep into the tissue of your foot. During the treatment, you'll sit comfortably while we use a device that looks like a small gun to apply these waves to the part of your foot where you have pain, usually around your heel where the plantar fascia attaches. These sound waves are pretty powerful and they move through your skin and muscle to reach your plantar fascia. They help by stimulating the area, increasing blood flow, and helping your body's natural healing processes. When you have plantar fasciitis, the plantar fascia is inflamed and can be very painful. The goals of using radial shockwave therapy are pain relief. Shockwave therapy can reduce pain by blocking the pain signals sent to your brain. The treatment promotes healing by stimulating the cells in their plantar fascia to repair themselves, which help reduce inflammation, which is part of what causes the pain in plantar fasciitis. Treatment usually involves a few sessions depending on how severe your pain is. Many patients feel better after just a few treatments. It's a non-invasive option, which means no surgery, and you can get back to your daily activities immediately after a session. The final thing I used was a topical transdermal cream containing both CBD and CBG. In the past, I wouldn't have considered it. There's a CBD store in every corner, and I found the results to be inconsistent at best. This topical preparation is put out under the Topical name, and I used their other products for antifungal purposes. When it came to heel pain, my rep convinced me to try it myself. The results were astounding. After applying 3 pumps of cream on my heel and rubbing it in well, I found pain relief in less than 5 minutes. Doing this 3 times a day for 3 days essentially took my heel pain away for good. Both CBG and CBD are cannabinoids, which are compounds derived from the hemp plant. CBG is a novel and powerful cannabinoid which is found in small quantities in the hemp plant. It's the precursor molecule to all other cannabinoids. There's new research frequently being published on CBG's effects. CBD is a proven cannabinoid supported by a large body of research and public use. Both CBD and CBG are non-psychoactive, which means the cream won't make you high. The CBG and CBD used in the Topical product are medical-grade hemp-derived isolates that have been certified for potency and THC-free by a third-party lab. The cannabinoids are formulated in the patented Topical delivery vehicle designed to penetrate through the complex outer layers of your skin. Poor penetration has historically been the reason topical CBD products are ineffective, and the use of this delivery vehicle has solved this problem. I can attest that it definitely has made a difference. I now carry Topical CBD and CBG cream in the office to allow my patients to experience the same relief that I found myself. It's sobering to have a condition myself that I treat so often in my patients. This experience will certainly make me a better doctor and hopefully will result in my patients getting better faster. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Be sure to request my free book all about heel pain and plantar fasciitis. I'm happy to send you a free copy when you request it at www.heelpainbook.com. The link is in the description. If you've been suffering with heel pain, help is on the way. Come in and I'll try to get you feeling better from plantar fasciitis as quickly as I did myself. The link to request an appointment is also in the description. Thanks so much for watching and have a great day.